Welcome to Virginia Currents. I'm Daphne Maxwell Reed. Aging in place is a goal so many older Americans find hard to achieve when on fixed incomes and with limited access to healthcare providers and pharmacies. To keep this dream alive is the Richmond Health and Wellness Program for Older Adults, or RHWP. It's held by students and faculty from VCU schools of nursing, pharmacy, medicine, and social work. Now, every week, the VCU teams set up shop at nearby Dominion Place, an apartment building for seniors. They offer free health services like chronic disease management, spotting potentially dangerous medical problems, care coordination, and medication education. While residents gain care, students gain valuable understanding of the needs of a growing population.
We want to help older adults age in place within their homes and not have to move to higher levels of care such as nursing home or assisted living. They have limited resources, social and financial, to be able to navigate and get the care that they need. So most of them want to stay within their home environment, and our goal is to try to help them do that.
You used to call us and let us come up.
When we started the program, we had somewhere about 30 to 40 residents that were actively engaged. Now we have about 110 to 115 residents, so I'd say that's success in itself. More residents are believing in what we do and relying on our services, and I think that's a testament to what we've built.
The design of the program, the direction, wasn't something that they constructed solely. It was from the voices of the residents. So the residents identified diabetes, hypertension, mental health as their main concerns that they would like to have addressed. So that's powerful that it's coming from the people.
Is it too much a problem for you all to come up?
It's not a problem at all, you know that. That's not a problem.
They exhibit a certain friendliness, a certain warmth, I would say. And to me, that's very important. To me, it's very, you know, with me, it's a little difficult, let us say, bonding with others, you know. And with them, I bond quite readily, and making it easier for me to confide in them and bring my problems to them, which they always solution, you know. And that is most important to me.
See that? You can see, yeah, that scar tissue a little bit.
I realize, you know, medical men just don't have the time, you know, to give to us that the wellness clinic does provide, you see. And that's quite welcomed.
Have you fallen down any?
No.
How are you doing with your medicine?
This clinic or this program is not meant to replace their provider. We're really an enhancement of those services, and that's ideally what we're all about. We want to improve their health status from appointment to appointment, and we do that by collaborating with their primary care providers.
How old are you?
How old are you?
93.
Our premise is patient education, chronic disease management, and the huge piece that's care coordination.
How you doing?
I'm doing protecting what my leg, my knee, the thing so weak.
They're weak. Yeah. How are the sores on your foot? How's your foot?
The foot,
We have the skills from being advanced clinical providers, no matter what our discipline is, to assess the patient and make a decision about the acuity of what their needs are and help them connect to care.
Better. At least we have the nurse help and watch it now.
Then we pick up the phone, we explain the clinical findings, and then we help them get in and get that need met within 24 hours or the same day. And the residents don't know how to navigate that. They don't know how to tell their story to make that happen. And that's one of the huge things we do.
I think some of the students who are in primary care, they don't realize that this might be the majority of the population they're going to be seeing. And so coming here, it's a really good experience and exposure.
The students who come out with me from the School of Nursing, they've been in the classroom with me also. So I see them when we're teaching them the theory. You know, when we teach them about what it is like to care for an older adult, what it's like to see an older adult age in place. So they see that in theory, but actually seeing them come out and work with the residents is a transformation.
Yeah, connecting classroom to real life experience, that's what we're trying to do.
Not only are we improving care of this population and teaching them geriatric principles, we're also teaching them about each other so that when they go out into the workforce, they work as a healthcare team. So we're trying to break down some of those traditional silos and improve collaboration, not only from patient to practitioner, but practitioner to practitioner.
They define their role working within their team and exactly what their expertise is at the time that they're working together, and then as they're here, what we start to see is a transition where they actually start to learn from each other. So social work starts to learn how to do that blood pressure check and what it actually means to do a blood pressure check.
And then they get to debrief and talk about a resident's issues together and come up with a plan together. So that's kind of a real change in the way you teach students.
Be aware of maybe some of the risks that could happen.
As a student, it was excellent experience for me to see what social work could do. Social work just looks at individuals from a much broader view, and I think that's helped nursing and medicine to be cognizant rather of, you know, the whole person.
So what do you like to do for entertainment?
Tell them about Sweet Pea.
Yeah, I already did.
Did you?
Yeah.
It's not just physical illness or chronic illness, it's just considering a lot of the different factors that come into play that affect that chronic illness. Considering the social supports that they have available, do they have access to resources like transportation, access to medication, helping them figure out what their insurance covers.
Let us get lab results and it says they're perfectly fine, but it's all in medical jargon and they don't know how to understand it. And there's like, what does this mean? And then so the students just go through and say, yep, everything's fine, but this is exactly what it says in plain English.
The other part that I think is really rewarding is, you know, preventing an ER visit for something that we can take care of. Coordinating a medication for something that may have taken them a week or 2 weeks to get, and actually watching the students organize and coordinate that process so that they can see some of the barriers.
Did somebody help you get the medicine straight?
We try to build a collaboration with community pharmacies and provide delivery services for those residents that need those types of prescriptions. And we reinforce their medications in terms of providing education, information on side effects, and we also provide special packaging through these community pharmacies. So those that are not as adherent because they can't fill a pill box or they can't take medications out of a bottle, we're able to package those specially through those pharmacy collaborations.
We're learning to hopefully not say what to do. We're learning to ask, you know, the resident or the client, what are your goals?
What do you want to work on?
And if this is your goal, have you thought about how you might want to do that? Would you like help accomplishing that goal? Because sometimes they say no, and that's okay, right? You know, and sometimes they say, well, yeah, I really want to be able to walk up the steps without huffing and puffing. And then we talk about, all right, well, you know, exercise or, you know, not smoking, to respect that self-determination. That it's their choice.
And you have control over your life.
Right.
And allows our residents to take greater care of themselves and take responsibility of their health. So it empowers them to age in place and to set new goals and to live a higher quality of life.
How long?
29 years.
You lived in Dominion Place? 29 years? Wow.
Longer than the rest of almost.
Some of them come from different cultural backgrounds than we do, as well as social economic, and it helps broaden our perspective of the life experience of older adults and why they make the choices that they do and what their needs are, so that we can help shape the next generation of workforce for nursing and other disciplines as well.
Came down one Thursday and my hand had swollen up and it was hurting, and they called my doctor that I didn't want to go right there, and they made me go to the doctor and come find out I had rheumatoid arthritis in my left hand. And I'm glad they made me go.
But you wouldn't have known otherwise?
No, because I didn't want to go to my doctor because I was afraid he was going to put me in the hospital, which he didn't. They're nice, they're amenable, and they care for the people that come to them. I just like to come down here and visit with them and talk to them, joke around with them.
So sometimes when we go to the physician, we see them as this great being that we don't necessarily ask questions that we think might be dumb questions or embarrassed about. But here, because of the personal relationships, you're able to open up.
They might not have an appointment, but come down just to say hi and see them expanding their life space and, you know, not just up in their apartment, but interacting more and just a greater vitality.
The most surprising aspect for me has been when students come out of the room and they say, wow, I had no idea. And on many different levels, whether I had no idea how sick they were, or I had no idea of how much I could learn from them, or I had no idea what it meant to provide community care. And then the residents, they're just grateful that we're here, and that's probably the best aspect.
It's just their personality, and their caring. And I think all retirement buildings should have this wellness clinic in their buildings. It could save your life.
In the future, our Rhwp could serve as a model for programs across the country that aim to help seniors age in place and cut down on emergency room visits and nursing home stays. To find out more, check out their blog at the site on the screen.